We'll call the November 12th work session for the Manhattan City Commission to order. If everyone would please rise and join me in the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Who's going to do the health center?
Do we have the representatives for the Konza Prairie Community Health Center?
Sometimes we have the staff person start, so thanks for coming.
Thanks for having us.
Yeah.
How have you been?
Good.
Well, I will be, in order to be respectful of your time, I will as brief as possible. My name is Manhattan. Our Manhattan location is, we rent space. We are at the main level of the health department, 2030 Tecumseh Road. We have decided over the past 6 to 8 months to start making the rounds quarterly and visit with the city and county commissioners, just updating them about our facility, our services, who we are, what we do, what we are to the communities, how we collaborate with communities, and any ways that we can become more involved. Because if you're not out there talking about who you are and what you do, how's anybody gonna learn? So I will do just a small, quick, brief background for those unfamiliar, and then transition into where we have become now in Manhattan. Konza Prairie Community Health Center started in 1994 in Junction City. It was co-located with the health department at the time. In 2000, moved to the location it is currently at on Grant Avenue. At the time, I believe there was around 10 to 15 employees. I came aboard in 2005. There was 15 employees at the time. At that time, there was medical services, quarter time behavioral health services, case management services, immunizations, and that was pretty much it. Since then, we have added full-time dental services, full-time behavioral health services, an in-house pharmacy, family planning services. We are a Geary County WIC agency. In 2010, we were approached by multiple state agencies with the shortage of oral health care about putting a dental clinic and expanding our clinic into Manhattan. At the time, the Riley County Health Department had space available, and so we met with all the parties involved, held a small forum, bringing all the local dentists in, explaining what we were doing, and got their blessing at the time, and then we added dental services in 2010. With the need of primary care services growing, in 2014, we added medical primary care services at that location, and then in just a few months ago, added behavioral health services. So since roughly 2005, we have went from 15 employees to around 105 to 110 employees. We started at 6 employees with our Manhattan location. We're now up to 22 employees. Our Manhattan location alone, in the last 12 months, from the 502 and 503 zip codes for Manhattan, had over 4,000 patients and over 10,000 patient visits. From Manhattan and Riley County total, there has been roughly 5,500 patients and about just under 15,000 patient visits. Total in both clinics, there have been roughly 1,300 veterans seen. Community health centers, we do provide a sliding scale for patients that qualify, provided they provide proof of income or lack thereof, and everyone is charged the same, but what they pay is based on their sliding scale. We see any and all patients, patients that have little to no income, patients that are business owners with insurance and are have plenty of income. Any patient that comes to our facility is treated the same. We have multiple services under one roof that is attractive to many people. We try to be a support system to our local healthcare providers, mainly the hospitals. It is important for us to provide access and keep patients out of emergency rooms, especially patients that it's not a real emergency, or patients that don't have insurance or need support in paying their bill. We can get them in, we can work with healthcare providers and work out a rate, specialty providers for patients that are uninsured. And it is important to we can spend extra time with those patients and educate them on the healthcare services we have and the options that are available to them, and focus on making sure that they don't use the emergency room for non-emergent visits. And it's worked out well. We've been able to support the local healthcare institutions, keeping patients out of the emergency room, getting patients healthier, getting patients back to work, helping them get to work, helping them find some type of insurance coverage. And it has, but aside from being, we wear multiple hats. We are not-for-profit. We are somewhat of a social service agency, but we do receive some federal funding, but federal government gives us just enough to be able to tell us what to do, but not really enough to do anything with. So a lot of what our revenue comes from is patient service revenue. So with that, though, we create jobs, and we support the local economy by creating those jobs and bringing professionals into the community, seeing patients, adding more services, creating more jobs, and the cycle continues. And it's worked out very well, and we have grown probably a little faster in the last 18 months than I would have liked, but sometimes opportunities present themselves, you don't want to pass them up. That is it in a nutshell. I'm sure I have skipped over some that I've wanted to address, but over time, every quarter, as your schedule permits, and if allowed, we would like to just come and update what we're doing, partnerships we have, potential growth in the communities, how we're expanding, what more we're doing, and how we can in any way be of more service to the cities and communities we're in. I'll stand for
Yeah,
questions.
thanks, Lee.
What have you been doing the last 18 months that has caused the growth that you're talking about?
I really don't. We were approached. The Kansas Department of Health and Environment wanted a lot of the services that they have health departments providing. They wanted community health centers providing also. So they have approached us, and we have started adding some of those services. We have been lucky and fortunate enough to be approached and partner with Save Farm program in support of the veterans. And we have added a school-based health center in the Junction City High School. So that's probably been the three biggest.
And what about is that a duplication of what's happening in the health department that the KDHE wants you to also do it through, or just making it more readily available without wait, or?
More readily available, and
Okay.
because we offer a full scope of services,
Right.
then those patients that don't have transportation as easily accessible can't get from appointment to appointment as easy. It's just in an effort to provide more services, more
Okay.
places.
All right.
That was also one of my questions was, how and what relationship this had with county health departments, but I think that was a sufficient answer. I have 3 questions. First, thank you for being here, because I've never heard of this before. So it's good to know that things like this are happening in the community. Just for clarification, the funding for the program comes from the federal government, correct?
Yes, it's about 5 to 10% of our annual budget.
How do you qualify for that? Like, is it based on the size of the metro area, or is it a qualification that a center has to meet and then it's distributed out amongst all of those?
There is a full application process. You have to, has to be in an area that the federal government determines it's an identified need. And what you see a lot of is current community health centers usually apply to expand their clinic into other locations that are identified as need, or you have a look-alike clinic, a clinic that has been operating similar, and then you can apply to become a community health center at that point. But initially, there are identified locations, and the federal government will release service area grants on because we're under the Department of Health and Human Services, and more focused the Health Resource Service Administration. If they identify a need for a service area, they will release a grant for that service area, and you have to apply and go through the whole process.
Got it. And also, just looking at like the services provided, if you look at like family planning or STD screening and prevention, and so if a young woman came in for family planning and got birth control, or for STD prevention you prescribe PrEP or Truvada, does your organization help with like the cost of those prescriptions?
Yes, we do, absolutely. There are some grants. We are what's called a covered entity, so we're a 340B provider, so we have access to discounted medications and medical devices and supplies that we can pass those discounts on to patients. And we have the ability, in some cases, for patients that truly have no means of paying, to write it off.
That's pretty amazing, just because I actually think for a lot of these things, there is a barrier to entry just to get into the building, right? But long term, you're like, why would I go in and for family planning screening knowing that I can't afford the ongoing cost of the birth control, or same for STD prevention and screening?
It's kind of there is that cost, and even before we were asked and before we had, while a Title X grant is good, sometimes it makes it a little more convoluted because there's so many, a process you have to follow and things you have to fill out. It's more of a common sense thing for us to write off the cost of a birth control, or spend more time on education on prevention, or abstinence. The long-term cost of that is much less than having an extra child, an unplanned, that you have to now take care of.
And then last question. So you've obviously gotten more busy over the last few months. How do we make you more busy, especially amongst people who are uninsured? I'm a little bit of a nerd of things like this in the community, right? And I didn't know that you existed. So do you get referrals from social services, or?
Honestly, we do. We get referrals from social services. We get referrals from private practice providers, we have good relationships with private practice providers, both dentists and physicians, and at the hospital, the emergency room will refer us patients, or patients that are being discharged. We'll get a call from discharge planners, and either to our referral clerks or directly to our providers, and we will get patients scheduled and get them seen. And we will get patients with our case managers to do a review and make sure that, if there are any benefits that we can try to get them, we will help. One of the other things that we do that I feel is necessary in today's world, even people with insurance don't always understand their benefits. It isn't very common today where the reps come out and meet with everyone and explain all your benefits. So we have our staff take time and sit down with patients that have questions and go through their benefits, and we have access to information and can cover everything for them, so they know what'll get covered and how much things will cost. Because just because someone has insurance and a job doesn't mean they have a lot of money in the bank, and so they can start to plan for that.
Thank you.
Thank you.
Yeah, so I have a few questions as well. Do you partner up with something like Flint Hills Clinic, Pawnee Mental Health, Via Christi?
I'm sorry, do we
School?
what?
Do you partner with all of these other
Oh, yes,
agencies
yes,
that we
absolutely.
have as far as, because now we have a stabilization center, and I don't know how all of this would fall into that if you're talking about mental health services.
Well, we do, Robin Cole and I tend to pass each other at a lot of meetings and always have the intention of setting down if our schedules would allow. But one of the things we do really well with Pawnee is, while we provide behavioral health services for those patients that need more specialized focused therapy, patients that are more difficult, even if they don't need a stabilization center, Pawnee is our go-to, because that really is not in our wheelhouse. We have some great providers. We have a psychiatrist, a psychiatric nurse practitioner, and multiple therapists, but there's still a certain amount of what we can handle with the staff that we have, and so we use them as a referral source. Bob Koppel and I have talked on multiple occasions, but our focus is just keeping patients out of the emergency room. And for those patients, we offer the same services as the Flint Hills Clinic, and our hours are, we're open Monday through Friday from 8 to 5:30, so we're open more, and if they need to send us patients, and we can help them out any way we can.
You said most of some of the funding is from federal agencies, but my question is, the presentation tonight, was this prompted by your organization? Did the city staff prompt it? What is the ask or the future partnerships with the city and county?
Right now there's nothing. It's just informative. Danielle Holiday, she came aboard in January and came aboard as a community development coordinator, took the grant writing off my plate, and she has a kind of an information plan for what we need to do to get out there and start speaking more. I finally had the additional staff where I could get out from behind a computer and get out and talk to the cities and counties and get the information out there. Annually, we work with our primary care association and have our day on the Hill, if you will, in Topeka, and visit with all of our lobbyists, and obviously Representative Phillips and Senator Hawk locally. I have talked with them quite a bit about our services and what we do and how we can support communities that we're in. But tonight it's just about information only.
And do you do this in rural areas? I think I saw something about rural communities, I'm not sure.
Yes, that is more of the focus of what you're going to see community health centers in, is either large urban cities or rural communities. There are 19 or 20 community health centers in the state of Kansas. We are a little different with our location in Junction City and Manhattan, and that whole area that we cover. In the last 12 months, we have had, of those patients I mentioned, probably we had over a total of just under 13,000 patients, and they came from 25 different zip codes. So the idea and the hope would be, and as we look at expansion, is trying to get into some more rural areas where people have difficulty accessing these services, but close enough to our home bases, so if we need anything, we're not getting too far away.
Yeah, I think that's my only concern. I think we have a lot of great agencies like yourself here in Manhattan, Kansas, but sometimes I'm concerned about Riley County being so vast and Potawatomi County being so vast that they may need some more mobile things or more staff. I also get concerned when we talk about staffing. One of the things we've consistently noticed is staffing in our healthcare field, whether it's nurses, psychiatrists, nurse practitioners, and I hope you're not taking from other agencies because we're working hard to keep them, but I hope you're also recruiting some to work in our organizations as well.
Actually, I have two physicians coming aboard. One started 2 weeks ago and another one starts January. The physician that just started, she's our new medical director, Dr. Megan Seidel. She is from Wisconsin. She was going to school in Illinois, and the other physician came from Southwest Kansas in Meade. So, yeah.
Good.
Usually any candidates we have found want to come back to this area because they have some type of family or roots here, have went to K-State at some point or another, are out of state and want to come back.
Okay. And I completely understand your model. I have great insurance, I've often said, but when I was a teacher, I couldn't afford my deductible. So this would have been a good resource to have for some of those needs, because we couldn't take care of some preventive measures when your deductible is $2,000 or $3,000 at some points. So thank you, I appreciate the information, and hopefully we have fewer uninsured folks also, because
That's the goal.
Yeah, we'll work with our legislators on that piece. Thank you.
Thank you.
Other things. First of all, I appreciate your being here. It's hard to find out information about our medical, the overview of our medical community and what specialists we have and when they go and come. And I think I remember, as I was sitting here, that your clinic is has a federal status, a federally qualified
Yes, it's called a
healthcare clinic or
Federally Qualified Health Center.
yeah, health center. And that is a very special designation that I've run into it on a couple of occasions. And to your credit, that's different than the Geary County Hospital or what Via Christi has.
Yes, it does. It does offer some unique challenges. There are some great benefits, and that we try to take advantage of those benefits and expand our resources and provide more services to patients. But there are at times it becomes difficult when we add new services, want to expand partnerships or grow with communities. Everything we look at has to be intertwined with everything we're currently doing. And with that, the guidelines and regulations that HRSA puts on us for our quality assurance, quality improvement, risk management program, they all have to meet those same standards and be looked at and be added for us to have our monthly reviews from a quality and risk standpoint. Okay. So every time we do that, those partnerships are great, and it's ultimately to us, it's just about serving the communities and the patients that we're in, providing access. And so we'll put in the extra time and effort to do it, but yes, there are pluses and minuses.
I remember when Riley County was going to be ending their primary care facility at the health department. And I was so pleased that about the relationship that you developed with them so that service could continue to be offered to low income and people that don't have insurance.
It has worked really well. And you know, Riley County, they have been a great partner, and it is nice to work with people that understand it like you do and that have the same mission in mind and that just want to take care of people. That is one thing we're looking at now is with the continued growth, we're kind of busting at the seams there. So, and I know there's an idea that as they have grown too, could utilize that space. So we've been looking at alternate locations where we can move out and stay in Manhattan and expand services, just because it's a huge need and it's important. And you know, we have a lot of employees that live here and love doing it, and a lot of relationships with dental schools and medical schools when we have students come through, and some want Junction City and some want Manhattan, and so we want to be able to give them that so we can create our own recruiting pipeline and keep those that are from here here, both to come back to work, and they shouldn't have to leave and go somewhere else to get their health care.
I'm sure you benefited from Dr. Jennifer Green being here as the health department director. She had such vision, and our whole region benefited from her presence and her knowledge. How has Irwin Army Hospital's reconstitution affected you? You know, they were closed and weren't sure it was going to be rebuilt. Then it was a long build, and now they're back in business.
You know, really, from that standpoint, it hasn't. we seem to be a resource for
Okay.
whether it's, we see quite a few soldiers active duty on dental, dependents on, for all of our services. And then a few months ago, were contacted about assisting and seeing if we could see active duty soldiers for medical too. So we tell them whatever they need from us, we'll be there. So they, you know, we collaborate back and forth, and will send us referrals for patients, and we just try to do whatever we can to help
So
out.
you're doing some of, you're serving the military population too?
Yes.
On a limited basis, because I can
Yeah.
imagine they
As
would be
they-
taking
yeah,
care of the
exactly.
majority.
As they need us to, and when they need us to.
Who do you share your medical records with? Just checking. You don't have to answer that. I think that's enough. Thank you very much. It's a pleasure to have you here and to better understand, because when you partnered with the health department, I looked at it and said, well, that's really strange. Junction City's having to come over here to serve Manhattan. But it has been a good relationship, and I appreciate knowing more about your facility and what you're doing. And my goodness, you've grown a lot.
Yes, yeah, it has. It you know, and there's still, as the population continues to grow in this area, and, you know, I had many meetings, and we worked really well with Lyle Butler. It was sad to see him go, but kind of a little jealous that he was ready to retire and take it easy. But looking at that growth and how we could be supportive in the Manhattan and Riley County region, and he, you know, was a great resource for years.
Well, thanks for coming, Lee and Danielle. I guess some of the things you're hearing here is some encouragement. And just from my own standpoint, I think one of the things that we always have to concentrate on is communications and networking. So how we, on a regional basis, inform all the people that need these kinds of services that all of these things are available in various places. And so just encourage you to continue to work with Robin and Bob and others as we maybe stitch this a little bit more formally into a network.
Yeah, I think so. I agree. And thank you very much it's been a pleasure to be here, but work with you and all the opportunities that have been presented. It has been good. And it's a strong community. You know, I went to school here. I lived here for a long time, and there's a lot more services now than when I went to school here, and it has continued to improve and grow. So that's a testament to all of you.
Great. Thanks again.
Thank you.
You're gonna do this by yourself, Jesse?
Yeah,
Never, okay.
always takes a team effort. Good evening, Mayor, Commissioners. Here to give you a little bit of update on the master plan and where we stand with future runway reconstruct. And I do have our consultants here with us, Mike Dimiterico from Kaufman Associates, as well as Diane Hofer, our engineer from Olson. So they'll be helping out in some of these slides, but I did want to kick off just kind of giving a little recap of where we've been and why we're here. So as a quick history, you know, our airport has 2 runways, but only runway 321 is the one that is certified for commercial air operations. And that one is the one that is in need of some sort of major repair or reconstruct, and that's what our planning process is evaluating right now. The crosswind runway that we have, 1331, is a much shorter, more narrow runway, and it doesn't have as much depth to sustain the weight. And so it is more designed for smaller GA aircraft than for commercial activity or military activity. And this has been a long, ongoing process that began several years back. And in 17, we awarded a 5-year A&E agreement to Olson. And in 17, later on in that year, we had to come back and ask for approval to go out for a planning grant, and we ended up getting a planning grant from the FAA and awarding that agreement with Kaufman and Associates. And so all these things have kind of changed timelines and expectation on what the project was going to be, but going from planning, we thought we could get this done in about 12 months. That was our goal, to have it 1 year. Notice to proceed was issued July 6th of 2018, but there has been a lot of additional scope added, and this is from the FAA side, where we were asked to do planning. And from the planning effort, they felt they didn't have enough design information. And so then they added some partial design with some core sampling. It is not a full geotech report that you get from design, but it gives us a little bit of a look and gives us better assumptions to make during the planning process for how we can go forward in construction. So all those things really caused a pretty long delay in trying to get that worked through the engineering side of it. So here we are now today doing our safety management system meeting this morning. So we'll have some challenges from this morning's meeting. Along the way too, we've had some challenges with the FAA on some of the direction they've given us, and as I mentioned, added some scope in the planning process that's slowed us down a little bit. They've also allowed for us to do the core samples, like I said, and that's going to be tied into a future design grant. And they've delayed us, giving us a design grant for the second consecutive federal fiscal year. One, because we're not really ready with our planning. Two, it seems that they are just trying to stock up our entitlement funds that we get each year, and so that way they have enough for a design grant with as little discretionary as possible. So right now they think that we could get a design grant in federal fiscal year 2021. They suggested that we just start as soon as we can with design, and we just carry the money until they're able to give us an award, but that may not come till much later. So kind of puts us in a little bit of an uncomfortable position. But to update where we are with our project planning, or the whole schedule, we got the federal fiscal year grant in 18 for planning. 19-20, I mentioned we don't have any grants from the FAA. Design, we anticipate coming in 21. Construction, 22, 23, possibly 24. Now that's funding of the construction grants. That may not actually be the construction itself. So we may end up phasing construction in a way to occur all in one shot, carry that burden until we get enough funding from the FAA over consecutive years. So those things are up in the air. The FAA is quick to tell you that they cannot guarantee future funding. Much of it is subject to Congress and when they get authorized and allocated, appropriated the funds. So there's a lot that goes into it, but this is kind of where we are now. It's kind of pushing us out a couple years from when we first discussed this a while back. Some important things to know. I mentioned the FAA cannot guarantee the future fundings, so all these timelines are just guesstimates right now. And there has been a reminder from the FAA that the federal language actually states that we're eligible for up to 90%. And as the central region, which includes Kansas, Nebraska, Iowa, Missouri, as funds get more competitive in our region, they're trying to see if they can spread that money out a little bit further. But we're trying to stick with the 90%, and we're urging them to kind of commit to that so that way we can have a better plan moving forward and knowing what our future bogey is that we have to carry. And unfortunately, we've had some conversations that have gone in circles with them too, and done some 180s on runway dimension. So early in the process, we were looking at the FAA standards on your fleet mix and number of operations, which drives the critical design aircraft, which drives what kind of runway dimension you need. The FAA came back and said, don't worry about that. You're going to keep your dimension, 7,000 by 150. We got a letter stating such. We got an email clarification stating such. We even had it stated in one of our advisory committee meetings out loud by the FAA staff. Unfortunately, that changed. Just on November 1, we received a letter from the FAA from our planner's manager. So it's the highest ranking official from Airports Division in Central Region, telling us that staff was mistaken and we do not qualify for 150 feet, we qualify for 100 feet only. And so that issue of narrowing the runway impacts larger aircraft, which are The majority of those are used by K-State for athletic charters and also for military activity, so, in military charters too. So there's some big impacts that we feel. Of course, the FAA does not take into consideration any military activity. This is a civil airport project, so they're only going to look at civil aircraft, being general aviation or commercial service. So they kind of discount those numbers, but the standard, and Mike and Diane may be speaking to this a little bit later more, but the standard is you have to have a category C3 aircraft that weighs more than 150,000 pounds come into your airport more than 500 times per year. And we're in that 150 to 200 per year range. And so it's hard for us to justify just from that standard, but that's a standard that doesn't really mean anything. It is just a standard that was written down so they had something to compare it against. So that's something that we're going to continue to debate with them as we move forward. And as I mentioned, as we're trying to move forward in this project, the next big step for us was this morning's meeting, which was the safety management system. And that whole meeting is required by the FAA in this process, and it gathers all the stakeholders. And we went through a lot of the slides and information. We had a facilitator that comes in, a third party, so not our consultants, but a third party gets hired and comes in, facilitates the discussion, and drives the questions of what kind of dimensions do you want? What kind of construction phasing? What does the local community want the best? What's going to impact the airline? What do you all want to see? And so it kind of gathers all that information. We should have a report in the next couple of weeks from him, a draft report that covers all the things that were decided upon or agreed upon today of how we want to move forward. But what I want to do now is bring up Mike and Diane. We'll start with Mike, and the next set of slides here are from his master plan presentation. So, Mike, it's yours.
Thanks, Jesse. Some of this is going to go back to our previous information provided in the master plan, if you've been paying attention at home. As we proceed, as Jesse said, we were in a slight delay based upon the need for some geotech work. We are now proceeding. We actually had an alternatives meeting in September, which we pared down those alternatives to basically 2 primary potential alternatives for runway rehabilitation. We presented that information today to the SMS panel, which was a pretty diverse group of individuals representing a number of different entities that have some importance attached to the airport. We had really good feedback and some good conversation. So this is what we talked. Basically, the following slides are what we presented to them. As far as the process goes, we are looking for a recommended development concept. The master plan, our work, actually is a 20-year vision. So we are not just focused on the runway rehab project. We have a greater scope than that. So we are looking at other issues as well. And part of that is to make sure the entire airport meets FAA design standard. And so there are some things that go beyond just the runway rehab project that we took to this SMS panel today. As an example, Taxiway Delta, which is highlighted here, there's a red box, it's hard to see, I understand. That Taxiway Delta is directly connected, it connects directly the link between the runway and the apron, and that is no longer allowed under FAA design standards, so that is something we needed to look at. We now currently have a situation where historical FAA's standards, and I'm going to use this word and I apologize up front, standards aren't always standard, they change, okay? So what had happened is historic FAA design standards created a situation where your north end of the runway, the other red box up in, on the, what would be on your left, looking at the very left portion of that runway, you have what is called a relocated threshold, sometimes called an aligned taxiway or a lead-in taxiway. Basically what had happened is the FAA took 400 feet of your historic runway and made it a taxiway because it was needed to be transferred to a safety area. And the reason that's important is because in our analysis, because of new standards and allowances, we believe that that 400 feet can be recaptured and used as runway, which gives the airlines, K-State, and other charters, large aircraft operators, 400 feet of additional length. And so one of our concepts is to reclaim that portion of runway, which we have a consensus on today. What it also means is that we're going to have to deal with your runway protection zone in the shift of that. If you look off each end of the runway, you see a white trapezoidal area. That area represents what is called the Runway Protection Zone, or RPZ. The RPZ is an area which should be clear of incompatible land use, and that, generally speaking, is anything that attracts individuals, either individual or groups of people, which are either, now it used to be simply housed there in some form or fashion, but now even transitioning through. And so we have to be cognizant of any change of that runway in that will also shift your RPZ, and we want to make sure that that doesn't then be, it is not then shifted onto an incompatible land use. And so what we have found is we can move that landing threshold on that runway about 30 feet. So that move will then allow us to get about 30 feet of landing on runway 21, which is a south flow operation. So those are all issues. Also dealing with runway rehab projects. Do I just click on it to go ahead? Where do I go? There we go. Here's a close-in look of what I'm talking about. If you didn't notice, that was a very subtle change. Currently, you have a 400-foot lead-in. That is not runway. We're looking at reclaiming that as runway, which will allow us to move the threshold back about 30 feet. But all pavement, all 400 feet are usable for takeoffs to the south. Okay, so you are gaining that pavement back for what is the most important operation at the airport, needing longer runway, and that is the operation of flow to the south for takeoffs. And so what we have today, we believe, is a consensus to do both of this, the reclamation of the runway as well as the shifting of that threshold.
Could you go back to that one slide
Absolutely.
one more time? Could you just, I don't quite understand all the colors.
Okay?
Could you tell me what the pink color boundary, the green boundary,
Yes.
the blue boundary, all of those boundaries mean?
Yes, great questions. The pink boundary or magenta is actually the jagged line, outline is your property line. That is the line that represents what property is owned officially by the airport. And what the FAA requires, generally speaking, is that that is the property which should contain the airport's operational facilities and all safety areas. So if you again look at the white trapezoidal area, that area should be contained on airport if and whenever possible. It can go beyond as long as the area beyond your property line is, for example, an agricultural use or an open area, which would no longer ever be taken into some sort of production. Here, we looked at shifting further, but there, believe it or not, there are homes just off the end of that runway in the treed area. There are about 14 homes back in and around there, so we really couldn't shift that threshold any further away because as we did, we would then encounter residences which left us with the option of either, the option of not doing it, which we've chosen, or shifting and acquiring. We believe that we have a pretty hefty sized project already, and the benefit of the additional 370 feet is not great enough to exceed the cost of the need of acquiring those residences and relocations. So our option was, let's just leave the threshold there, keep the RPZ within that pink boundary. As far as the others, the blue box represents what is known as the runway safety area, or RSA. The RSA is an area that has to be clear of all obstruction, and it is specifically designed to allow for aircraft to leave the runway environment and actually move without any significant structural damage. As an example, yesterday an aircraft slid off the runway at O'Hare into the safety area, and that area is stabilized so that aircraft will not basically be destroyed by simply moving in it. So it has to be clear and graded. The area just beyond that in the, what I call the neon green, is your object-free area, and that area doesn't need to be stabilized on the ground, but needs to be free of obstruction so that if an aircraft is in the safety area, its wings are not going to be hitting anything, again, for structural and safety purposes. And so all of those areas have specific design parameters that need to be met, again, which we have to do in our process. As far as the direct access issue, this is again a better highlight of that. Taxiway D, or Delta, is a connector taxiway allowing for the movement of aircraft between the landside spaces and the runway itself. But as you can see, an aircraft can actually, if not paying attention, an operator can, for example, leave the apron area, traverse the the taxiway surface onto a runway without making a turn. And the FAA, through many, many hours and I could say years of going through these things, have found that when pilots have the opportunity to make that kind of movement, they tend to not continue to have a great situational awareness. And that can incur runway incursions or can promote them. So the FAA is in a move to get rid of any taxiway that leads directly between these surfaces. And so our option is one of two ways. You can either remove it completely and just allow it to be removed, or to remove it and relocate it as we're presenting in this option here. What we're suggesting is shifting that taxiway surface when the runway is rehabbed to remove the current pavement, shift it to the north and east so that it is further away, which would allow for a greater capture of options of aircraft landing on runway 3. So as on your side, what you're looking behind me, an aircraft landing 3 coming towards Delta would then be able to get off the runway and not cross through the crosswind taxiway, which is definitely a benefit for Tower. This is something we are going to put on our proposed plan, but this is something that will be at the mercy of funding eligibility. It is 100% eligible. It is a safety issue. What I'm going to suggest, though, is based upon the size and scope of what we have to deal with on the remainder of the runway, it may just simply fall out because of lack of funding availabilities. And so it's one of those that'd be nice to have, and it should be continued to be planned for, but it would be that first thing you would drop out if you just don't have the funds available to do it. So we will plan for it, but it's going to be down the list of priorities.
Is it possible to demolish it but not relocate it?
Yes.
What
Yes.
is it that would cost $329,000 to demolish taxiway D?
Actually, I think it was 600,000, wasn't it?
300.
600,000, yes. Pavement removal actually is quite a costly adventure, is the word I could use, because it's a very thick pavement surface that has to be destroyed, demolished, and then removed. And so that is an estimate based on historical expenses. It could come in lower than that. And again, that's something Diane can speak to more specifically, since that is something she prepared. But it is a very costly thing. And many airports across, especially historic military airfields, which were really overbuilt, have this problem, where you have excessive airfield pavements that just remain until they crumble because it's so expensive to remove them. Here, we have to remove it simply because it provides that connection. And if you don't remove it, pilots may continue to traverse that surface. So that is the reason for that. But yes, that question's a good one. It can be removed and not replaced. As far as one more piece of, one more item that we dealt with, the FAA is in the process of changing or standardizing, standardizing airfield nomenclature. I talked about taxiway Delta as an example. Historically, an Alpha system was used, and it was generally accepted that it would be in order. As an example, at what you're looking at behind me, South End is Alpha, and then it goes to Bravo, Charlie, Delta, Echo, Foxtrot, Golf, and the like. What the FAA is now suggesting is a better formula is to start at the north end of the runway and use the parallel taxiway nomenclature to begin as Alpha, and that add a numeric to each exit. So the first would be Alpha 1, Alpha 2, Alpha 3, and so forth. And so that again is a suggestion we are putting forth that is going to be carried through with consensus from the SMS panel. The last two slides that I'm going to speak to are just going to introduce the issue of runway rehabilitation. We could get into a lot of weeds, and I know that Diane is going to do a really good job of explaining this, but I will tell you that at this point, we have narrowed the field pretty good, and there still are many, many, many options that could be explored. We still have, I think, some work to do on things that came up today on dealing with this, but what we have done is we've pared down all of what we call the likely and reasonable alternatives to 2. And the alternatives are this. You simply tear out all existing runway pavement and replace it as it were. Maybe beef it up a little bit to be heavier strength, but basically tear out old pavement and replace it. The other option is to what we call is rubbleize the current pavement section and then pave over the top of that. And what that would mean is that there would be a device, there's a machine that will actually come out and pound the existing concrete into very small aggregate pieces, which would then remain in place, usable as your basic surface, and then you would pave over the top. That creates a surface change. It will create a higher pavement section, which would then have to be carried out, as Diana will explain. Those are our two options for pavement rehab going forward. The two sub-options of each of those two options is this. We phase closure, and I use that specifically to point out that there's no way to do what we need to do without closing the airport for some period of time. Our goal is to minimize closure whenever and if at all possible. But one of the options is to phase that closure and minimize that, and the other is to proceed with a fully closed airport to allow for everything to happen as fast as possible. And so those are the two things that Diane's going to speak to, and I have one last thing that I am going to speak to, and that is something Jesse opened with, and that is the runway width. I'd like to apologize because frankly, this is an issue we wish were dealt with much earlier. We were given the go-ahead, even after identifying the standard was what it was, to the FAA specifically saying that we don't qualify for that standard. The FAA returned volley by saying, we approve you at that standard, plan for it. Unfortunately, that was caught by somebody above, and then that was pointed out this week. We had a letter saying they are not going to approve the eligibility. And I want to be clear, just because they don't approve the eligibility does not mean you cannot do this. What it's suggesting is they can't, or they may not participate in the funding of the difference between 100 and 150. So in other words, somebody can pay for the 150. They're not saying you shouldn't have a 150-foot runway. They're simply saying their standards are 100 feet, and that's what they can pay for at 90%, as Jesse had mentioned. So what we are working on is an understanding, again, the current critical aircraft, which is being designed around, which meets the 500 annual operations, is the plane at the top of this. They look similar, they are not. The plane on the top is what is known as an Embraer 175. That is a regional jet with up to, it's been modified upwards of 80 passenger seats. That is the future of American Airlines operations at this airport without question. And in the very near future, you're probably going to be seeing these airplanes at the airport. And so that airplane is a Group 3 airplane, but it does not weigh 150,000 pounds. So the standard, the FAA standard, is the support for a 100-foot wide runway. The aircraft below that is a 737-800 model, which does meet Group 3 above 150,000 pounds. So if this were your critical aircraft, you would have that support. Unfortunately, we do not have that, and we are still going to continue along the plan with 150-foot wide, and this is where we have the issue of unresolved issues, because the width issue does come into play in the myriad of alternatives that could come out of that. So we are going to present a continued front where 150 is the plan. We believe it's necessary to accommodate K-State in its athletic charters. We also believe it's necessary to support the military Fort Riley in its civilian charter of military personnel. And we believe those two functions are not only important, but we believe that they are consistent and have been for years. This is not a unique airport where you see one or two of those a year. We're seeing anywhere from 100 to 200 a year. So we believe that that threshold is consistent with what you would call your most relevant aircraft. So we're going to try to continue to argue those points and plan for the 150-foot wide runway. So that's where I'm going to end. Any questions for me?
Yeah, I have a question for
Yes,
you.
ma'am.
So I'm confused.
Yeah.
The 150, 100. I understand the dimensions themselves. I'm confused when you say the FAA will pay for 90% if it's at 150.
No, they'll pay
At
for-
100.
At 100, correct.
Okay,
Up to 90%, we've been told.
okay. So what does that mean exactly as far as they've changed it along the way. Is this where they're going to stay, or is there more room? What does 90% look like?
Well, the numbers, and Diane will hit on that, but the difference, the original, in one of our design options, the difference between the full cost of 150 foot versus 100 is about $4 million. So theoretically, let's take it down that road. Theoretically, if the FAA holds and there's no further support obtained for federal funding assistance, you could be on the hook for another $4 million than would have been previously obtained if you had that justification. And so that's basically you'd
That's what
have
I
to pay the
wanted to
extra.
know.
Yeah,
All right, thank you.
you're welcome.
This is probably falls into more of the line, a question that's American Airlines business model, so maybe you can't answer it. But aside from what K-State and Fort Riley does, when we just look at the region's growing, and so activity at the airport will probably increase over time. Is it, if we built the 100 foot only to 100 feet, let's say, is it more likely that American would want to bring bigger planes or more connections with the smaller 175 model? What do they tend to do in airports as they grow?
It's a very good question. I will tell you, I'm gonna give you two answers. And I'm gonna first tell you that I work all over the country. I work for airports all over the country. And this is the type of airport we work for mostly, this level. And I will say that you are a trendsetter right now. If you don't know this, by the way, you are setting trends that have never been seen before, ever. In that you have foregone EAS, the Essential Air Service funding, basically the subsidy from the federal government. You went on your own. You went from an airport that had been historically EAS and about 10,000 enplanements every year. You dropped EAS, you not only gained one market nonstop that had a large hub, you gained the second. And you now have 3 flights a day to each of them. You've year over year grown double digits in, again, a regionalized market that's only an hour and 50 to 2 hours and 15 minutes away from a large hub, or a medium to large hub, plus other hubs in the region that are relatively close. The point I'm saying is you're doing very well in a market where you would take this anywhere else, you would see completely the opposite, either stable, flat growth or declining growth. And so you should be very proud of that. I will tell you that even in that setting, your top end will likely be a large RJ. The next level is the 900 models, and they go anywhere from 90 to 100 seats. Very nice airplanes. KCI has a lot of them, as an example, just down the road. They use a lot of RJs there. And so I would suggest that that length of 100, or that width, is not going to set American Airlines model. They're going to continue within the RJs, and the RJs are going to be comfortable with that dimension. It's not going to be a determiner of not being here.
So when we're talking, in your professional opinion, when we're talking about the difference of the width of the plane, that 50 feet largely would only affect K-State and military operation, or what the business that we do with K-State and the military.
It would be the greatest cause of concern for those two operators, correct?
Thank you.
Absolutely.
How wide is the runway now?
150 feet.
Okay, so we'd rebuild it smaller, is what you're saying?
Yes, you would be reducing the current width down.
When Salina and Topeka have rebuilt their runways or are in process, what widths are theirs? Are their airports?
Topeka just went through this process, and they actually had a 2-year process when they did half and then the other half. Their runway was 200 feet wide, and they actually narrowed it to 150. And the reason for that was, and it was a good reason, it was a military standard. The only thing that operates to 200 foot is military.
It was an Air Force base, yeah.
It was an Air Force base, correct. And so, same with Salina. They are also narrowing. They're currently
To
150.
150?
But they're currently at 150. They have the outer 200 that they don't use, and it's falling apart. It's deteriorating, causing VOD issues. But it's likely they're going to face the very same issue in
And
that
we are.
the FAA will want them, or only allow them to support eligible funding at 100. Correct. The FAA, in their defense, they're not here, so I'll give them this. This, and Jesse hit it well, this is largely part of the problem is, or most of the problem is Congress. The fact is, the FAA's been under a grant program that had a total allowance of about $3.3 billion for the last 15 years. So the same 3.3 billion 15 years ago is spending today, and we all know what's happened. We've had significant growth. So the buying power that the FAA has been significantly reduced. And so that said, in their benefit, they have 3,300 system-wide airports that they have to fund, and so they're trying to be good stewards of that funding. So I don't believe, and I don't believe Jesse thinks this either, that there's any mean-spiritedness going on or directed at your community. It's simply they're in the reality of limited funding situations. Also in a reality where Des Moines, Omaha, St. Louis, Columbia, Missouri are all looking at major runway projects. And so they're looking at a need to fund them all at the same time. So again, it's just one of those realities where it's a challenge for all. But we're going to continue to argue along with 150 as being your ideal width. Yep, Diane.
What about length?
Good question. Again, 7,000 is your current length. That's one thing we're gaining. The FAA has agreed to support the recapture of that 400 feet. So in this process, we are adding length.
7,000.
So we're going to go from 7,000 to 7,400 feet.
7,400,
Yep.
okay.
Yep.
Thank you.
These are great questions. I know you're going to have more as we go through, so I want to get Diane up here and start going through some of the engineering side of this. You can just scroll her arrow.
Okay. Good evening. We were asked to look at how to phase this for construction and what the cost and the amount of time that it would take to do this. So the multiple phase alternative included 4 phases, and in 2 phases, the main runway would have a reduced available length of 5,500 feet, which the airline could continue to operate, although they might have reduced capacity. But in any of the phasing options we're looking at, in this case, the red is the closed pavement and the blue area is where we're working. So when we get to the runway intersection, there's no way around it. The airport would have to be closed. We're looking at a airport closure of at least a month. And depending on what phasing process we go through, it's not like a road where you can just close 1 or 2 lanes at a time and keep the intersection open. You have to close the whole thing down. There's not enough money to do it any other way. And then in this case, the 3rd phase, we would be able to open up the shorter general aviation runway, so there could be private aircraft, business jets, that sort of thing could come back and operate at that point with the main runway still closed. And then in the 3rd phase, or the 4th phase, the main runway again has a shorter length of that 5,500 feet. So we've thrown around a lot of numbers today. I've got to look at my notes. We're looking at the 4's phase option, that the main runway would be closed just short of 2 months with a reduced length for about 40 days on top of that. So about a 3-month construction, 3 to 3.5 month construction period. We also looked at combining phases, going down to 2 phases, or what if you just shut the whole airport down, how long would it take? It would still, we're looking at roughly maybe about 80 days if you shut the whole airport down, just let the contractor go to town and work everywhere he wanted to work all at once. There's just a large quantity out there of work to be done, and just looking at a reasonable construction period without increasing costs that the FAA wouldn't support. We discussed doing a work 24/7, 7 days a week, and the difficulties with that, potential for reduced quality, difficulty getting the labor pool to work. Who wants to go out and work on construction at 4 in the morning? It's hard to get that done. So that would increase costs that I don't know that the FAA would support. They might support that increased cost in the intersection only. So just looked at a lot of different options of how to phase that, but the end result is, unfortunately, we're going to have some period of closures there. Looking how the phases overlap and then how much time actually happens, we looked at both reconstruction and rubblization. So this is just a lot of details in your packet. I kind of gave the overview there of that, how that goes through, how the different phases kind of dovetail and overlap each other. Where are we getting to? So the 2 pavement designs we looked at were complete reconstruction. So we would tear out the existing concrete surface which is about 13 inches. There's some asphalt underneath in some parts. And then below that, there's some original concrete or cement-treated cement material below that from probably around 1960. So we're looking at digging out 2 to 3 foot of material. Would make great riprap for the Bureau of Reclamation, but anyway. And so that would take a lot of time. So that full reconstruction effort, we were looking at about 145 days, so that's around 5 or 6 months, and that was a real problem with all of that. Adding in drains, we will have to raise the runway elevation in kind of the middle southern section of it. So there's a detail here that just shows a higher elevation with more dirt work in that area. Whereas the white topping, the rubblization, it's kind of a resonant breaker, so you can't just hammer it because you're only going to break the top of it, but we have to make sure that it breaks all the way down. That 13 inches has to be broken all the way through, so it's more gravel-like. It would be larger, up to 2-inch material. And then you might have to do a leveling course, you might have to kind of create a crown, you might have to add some material in the middle, but and then come back with 14 inches of concrete on top of that. So more concrete in this option because your structure, you're not getting down and digging out all of that base material underneath, so there's some weakness underneath there, but it's a lot faster, it's actually less expensive to put on more concrete but fewer layers.
What about durability? I mean, how long one method would last versus the
Well,
other?
they're both designed for a 20-year life, which is what the FAA says they will pay for.
Okay.
I'm going to say, and there's really no way to calculate the exact life of it. Your current concrete is 40 years old, so it's not unusual for a concrete surface to last 30. The average concrete runway out there at your size and larger airport is 34 years old. So at 40 years, you're above average. But if you think about it, if we could go down and tear everything out and get all the bad material out underneath and build it back up fresh, you do have a higher chance of success with the reconstruction, but the cost is just not conducive to doing that. This is going to give you a very serviceable life. White topping, rubblization has been around. Now it's probably been in standard use for about 20 years, so a lot of good experience with that. So I'm real comfortable with that.
How was the Topeka runway reconstructed? Which method?
That was full depth reconstruction.
Full
so they
depth.
tore everything out and started back up. Yeah. Theirs was asphalt, some of it? No. It was all concrete. Okay. Right. So part of the problem is just where the two runways intersect, how if the intersection was farther to one end of the runway, you could keep the main runway open longer, but just a lot of circumstances that don't allow for any other phasing without that runway shut down. Cost estimates, so the construction cost, so this is the full cost looking at if you look at the very top, PCC, that's Portland cement concrete, reconstruct at grade, phasing versus no phasing, so you're looking at $45 to $48 million for that. The phasing cost is the contractor has a lot of different subcontractors that come in, removal, aggregate base, grading, so they would move in and out as the different phases are completed. That adds actually quite a bit of cost to it there. When you get to the rubblization, we're in that $39 to $40 million range. With rubblization, there's not as many subcontractors, and they're able to work more in sequence, one after the other, so they can come in and do the entire job all at once. They're part of the job all at once, and they don't have to come and go. So now you look at the construction costs and what we've had to do, because we're still just in the planning phase. There's a lot of data we don't have. We haven't done a drainage study. There's some significant drainage features on the airport. We haven't done any pavement evaluation on the taxiways, but we're going to have to rebuild some of those to match the new grades. We don't know where the lighting system goes, all of it. So we made a lot of estimates in there, which is what all those percentages are. It's just to show you that we've added a lot of contingencies, a lot of unknowns, because we want to plan at a reasonable to a slightly high level, so that you're not gonna have surprises. It's not gonna be 50% higher, when it's actually done. Now, the unknown we also don't have is inflation. So this is 2019 costs, so that if we have substantial inflation, then my whole 50% higher might go away.
This might be a question for Jesse on the, when it comes to costs, like what we have been told repeatedly and what was marketed with this sales tax was the buy-in for us was probably gonna be $5 million. So when you take FAA assuming funds 90% of the highest cost 40 million, it's about 4 or 5 million. Is that where we're getting that number and where it's coming from?
Yes and no. So the original plans that we submit to the FAA, the Airport Capital Improvement Plan, had both the runway as well as the taxiway. And so when we were looking at combining runway and taxiway projects, because taxiway also needs reconstruct, it was about 55 million. And so at 90%, that's where the 5.5 million came in as our portion of it. What we are looking at here is strictly just the runway. The runway, though, when you do rubblization, since it raises the elevation, you're also doing a lot of the adjacent pavement. And so those taxi lane connectors that get pretty close to our taxiway are also being included in this. So the FAA right now, with their limited funds and all the competing interests, aren't funding taxiway projects. And so this doesn't look at taxiway alpha. This is just the runway and some taxi lane connectors. So it's
So
close to that number that we had.
So the cost, even if we assume the FAA funds up to 90%, which the political climate you just described to me suggests to me that we'd be pretty lucky if they funded up to 90%. So regardless of that, the cost is actually quite more significant than the 5 million for the city.
If you're combining the taxiway with it,
The other
there's
thing is
potential
that
for an
if we have
increase.
to go to pay for the other 50 feet,
Yeah.
then we're up at $8 million.
Right, so these costs are for the 150-foot width. So should the FAA pay 90% of the 150-foot width, the city's share would be $4 million.
And if they don't, then the city pays $8 million.
We're looking at 8.5, yeah.
And just, I guess I make that point to say, the conversations, I mean, what you've described on the competition for that funding, I guess just from what you're telling me, I think we'd be pretty lucky to have it be funded up to 90%.
They can never make guarantees of future funding. They have made statements to us in the past week that they will do whatever they can to help support us at 90% of what is eligible
When does that get lost? Like, when do we know that for sure?
when we get a grant offer.
And I would just say we've never had one less than 90%, and we've had them up to 95%. So that would be a huge issue nationally if they start going below 90%.
The 90% was a temporary feature from, started around 2004 to about 2011. So the 95% had to do with some economy and some other aviation issues that, so all grants are 90% unless you're one of the large hub airports. So that's how the statutes are written. Now, apparently FAA is considering that up to 90% issue. And so the last cost estimate, and this was the taxiway D removal, so there is quite a bit of pavement thickness there. Then you have to bring dirt back in to fill up the hole, regrade the whole area. The electrical system goes up and down the taxiways and in and out, so I have to redo a bunch of that electrical work in there. And so that's the initial cost estimate. That, my gut feeling is that that cost is probably a little bit high, but that would remove taxiway delta. And then if you were to construct a new one, option one is the reconstructing at grade, and option two is with the rubblization. One thing that has happened with kind of the project over time, over initially say 5 years ago, is the initial cost estimate that at the CIP level was just the runway, and what FAA has asked us to add into this is these connector taxiways in both options, rebuilding those connectors so that in the future, if you didn't do those now and 5 years from now one of those taxiways needed work, you would have to shut the runway down to work along the edge of the runway. So that would avoid future runway shutdowns, but that did add to the overall costs of all of these options. And it only makes sense to go ahead and take care of all of those pavement problems within the vicinity of the runway all at the same time.
When it comes to the closure, and I realize you or the FAA, I want to say FFA. I was a big nerd in the FFA when I was in high school, so I keep wanting to say that. We would never do anything that was unsafe, but I fly a lot for work, so take this with a grain of salt because I'm just in my consumer mindset right now. When I fly, for some reason, nothing unnerves me more than when I land at the airport and you're coming in and you're coming too fast and you have to take off again. For some reason, that just unnerves me. I would make an assumption that if the end of the runway was having construction, that the likelihood of that happening would be higher. So as a consumer, just wanting to prevent that, I might make the choice just to go to Kansas City until the airport's finished. So when you have done these projects in the past, do you see behaviors change in the amount of people that are utilizing the airport when there's construction going on the main runway? Because I would assume the point of keeping the airport open is we're still generating revenue. But if people's behavior's changing and they're going elsewhere, would it make more sense to just close it all at once?
So people are buying airline tickets 3 weeks to 3 months ahead of time, and they're not aware that this construction is going on. I don't know, Mike, if this is something you can help there.
One of the bigger, I would call it a bigger issue to deal with, would be the fact that we will likely also lose the capability of instrument approach procedures for some period of time. And what that means is, most commercial airlines want to have a reliability of schedule, and that cannot be dictated by a little bit of fog or some cloud heights. And so the problem that we may encounter with a phased position is that once we at some point lose approach capability, at least the lower level approach capability, you may find that the airlines would be reluctant to operate here because, as an example, they don't want to leave Dallas, fly to Manhattan and find they can't land, because then they have to go back or go sit at an alternate. And so if that were to happen, you will be likely that the airline itself will be the consumer that says no more.
So that's actually an interesting point. It just happened to me last week when I was flying to Denver. So much fog, you could not see the runway until literally the wheels were on the ground. So you're saying essentially we would lose that capability for that plane to land for a period of time.
Yes.
And so an airline wouldn't want to operate.
Yes, and you'll likely be able to, with the assistance of center controlling and even Fort Riley approach capability, to have what is called a circling approach always available, which means an aircraft can maneuver to a specific point in space, and if they break out of clouds or out of fog or low visibility, they can then continue on their flight in a visual manner. And so that is a capability that the airlines may be able to work around, but if the continued weather phenomena is such that it's creating a financial disadvantage, they would probably just quit operating. I would suggest that that's more concerning than would be a individual's changes, because I don't think that's going to happen unless airlines start canceling flights, which is why I start bringing it up.
Okay.
That
So
reliability factor is important.
consumer behavior changes unlikely, airline behavior changes
Yes.
a little bit more likely.
Yes.
Okay.
Especially business travelers. When we find at regional airports, once you're canceled more than once, that airport becomes toxic, right? Because as a business traveler, you've got just-in-time travel most of the time to save money. And if you miss a meeting once, okay, shame on me. Miss a meeting twice, it's shame on you. And so you start making different choices. And so again, at that point, if that were an issue, I would suggest that the choice would maybe then go to full closure to get it done quicker.
Okay, thank you.
Yep.
Questions?
I believe that was the final.
Yep.
We can ask the public if we want first. That's folks that. So, Mike and Diane, if maybe we ask the public for comment now, and then we'll
absolutely.
come
Sure,
back
sure.
and
Yes.
with some questions. So, any public comment, please? Linda?
Good evening. evening, Mayor and Commissioners. I'm Linda Cook from Kansas State University, and I just want to speak on behalf of the university and athletics in particular on the importance of maintaining the 150-foot wide runway. Athletics has worked with their charter company, which is run by United Airlines, and they've explored the situation, and they've confirmed that they would not be able to land any of their charter planes at Manhattan Airport if it was not a runway that was at least 150 feet wide. That would impact all of it, predominantly the football team, but also bowl games. When the Alumni Association does charter flights out of here, it would also include some other sports, some of the basketball when they're headed off to tournaments and playoffs. It also would impact visiting teams flying into Manhattan because they also would not be able to land here, which means they would probably choose some other airports. And after talking with athletics, they said they would probably also spend those hotel nights in whatever city those airports are in. So it does have a ripple effect in some of the other economic impact to the community. So from K-State's perspective, it's important to keep that 150-foot wide runway. We do probably average, athletics does about 25, 30 flights per year. And that's just our charter flights going in and out, or going out. It doesn't count any of the visiting teams, what those numbers of flights would be. So whatever we could do, we would like to be able to support that, maintaining the width of that airport runway. Thank you.
Thank you.
Did you want to comment, Rich, or?
Rich Jankovich, representing the Airport Advisory Board. I was at the meeting today, and there's a couple things that I always put both hats on because I know where you're sitting, and I kind of have to represent both sides sometimes like that. When we talk about the airport closure, we're not talking about having, even though you have runway closure and airport closure, there's times in that entire period where there would be zero commercial air service. I want you to understand that. So closing that down, we have a 60 to 90 to 5-month window where we would not have service because the runway would be too short for any kind of use. Opening the airport would allow some general aviation. Speaking out of turn? Okay. Jesse's supposed to kick me if I get too far in this. The narrowing of the runway to 100 and the elimination of the ability to handle the charters, which we're somewhere in the 150 range in the type of aircraft that are 150,000 pounds and greater, puts a high probability of losing an FBO, which would be Kansas Jet Center, and then being able to service in some fashion, either by hiring our own staff to deal with fueling issues for the airline, or they would have to come in and do that. There's a multitude of other pieces that goes along with the narrowing of the runway. Then, it gets into other economic impacts and how we deal with that. It will put a strain on all of the, during that time period, as we think about it, it's going to put a strain on anyone that is involved with airport for revenue, not just the FBO. It'll impact the Heartland Aviation, which is considered an FBO. It'll impact, what's the air service? No. Flight training. FlexAir will be impacted significantly. Obviously, the airlines impacted significantly. The good news is, in this entire process, we've got probably a 4-year window to get us there, and I think the consensus was to stay with the 150 because it makes the most sense for how our airport is used. And I'd kind of use the analogy of how we walk through the process with the larger aircraft, and how we had to deal with the security side of that and what that cost would be and how we mitigated some of those issues. That doesn't mean the FAA is going to bend, but that's kind of, I think, the focus that it's going to go and how we move that forward. but it's a significant impact to the community to have that shut down and how we handle that. And I think thinking farther out as we get closer to that time, how we manage that from a marketing standpoint, because if we close down for too long, it significantly impacts greater. And how we make sure that we retain those flying customers. And then there's gonna be talks obviously with the airline and with the FAA and everybody else. But I think as you evaluate that, and obviously more of the decision process will happen after the first of the year, probably in the next year, how we fund that those are critical pieces that I think have to be considered as we walk through that. So, you know, there's lots of moving parts to it, but it's going to be difficult. And the rubblized reason I think that that's you see that up there more, it's a much shorter time period, cost is less, but it's also more weather resistant. And I was joking today in the meeting, just think about Kimball Avenue, and Ron and I had had a couple conversations about that. Weather impacted that significantly because of the amount of work that had to be done to get it down to the base where they could put new underlayment in to put the concrete on, and that's exactly what would happen in a full reconstruction. So there's a lot of things that go with that. The other parts that were mentioned, if we narrow the runway, then we have to move all of the lighting, nav aids, everything, and I think all of the approaches have to be rewritten and approved. Question was asked today whether or not that would be as a reactive or as a proactive, and it would be a proactive. Once the plan is agreed on by the FAA, they would begin working on getting all those things done as well, so that when the runway's certified, everything else is ready to go, so we don't lose that opportunity of traffic. Does that make sense? We good? All right, there you go. Questions? The board has not seen this fully yet, but we have vetted multiple of the original ideas. We'll probably talk about that in next week or 3 weeks from now, so, okay.
Thanks, Rich. Anyone else? All right, let's come back to the commission then. And questions?
I just want to try to figure out if I got this financing down. These are all finance sort of questions, and it looks like with this taxiway, and assuming you're going to do a 150-foot runway, and the FAA not funding the after 50, we're looking at least 8.6 million,
Well,
close to 9.
I think we need to rerun those numbers, because it would be 90% of 100 by 7,000. So it's not a clean, take the 4 now and add another 4 to it. So maybe a little bit less. It's still a significant number.
Okay, I'd be interested in somebody crunching those, because, people are going to be talking about that.
Right.
Exactly what is this going to be? And so that's the big one. Then the second question is, in the original slides there, the FAA mentioned something about we should do this design up to 30% before they would consider, giving us the grant. What's that mean in dollars?
So that was a question I had asked, and these slides were originally submitted on Thursday. That's our deadline from a staff perspective. I got a phone call from the Central Region Manager after I submitted the slides. And so one of the things that was mentioned was, we're going to do whatever we can to help you get the 90%. They can't ever guarantee it, but they backed away from the language of, hey, don't forget it's up to 90%, you'll be lucky to see that much. And so there was a little shift, and that came from their management. So we're going to rely upon that moving forward. So hopefully we get the 90%.
Okay, but we still end up having to pay 30% of the design costs up front, right?
No, so let me make sure I'm clear on how I communicate this.
Let me go back to the slide here.
What that comment was, the question to FAA was, how much percentage are we going to get on construction? They kept telling us, we don't know, up to 90%. So that's a large bogey for us to carry. Can you give us some more information? Maybe when you're done 30% through design, we'll tell you what your percentage share will be in a construction grant. So that was the statement that was made right there in the slide. So
Yeah, it said we should carry the cost until the grant is issued, and
well, that's That's two separate things. So telling us the future design, or excuse me, the future construction grant was the response of maybe when you're 30% done with design, we'll know how much money you're going to get. Okay. The other, let me give it one more shot in here. The other issue was, when do you start design? Do you start it when you actually have a design grant, or do you start it sooner than that? And so that's where the FAA said, start sooner and you carry the money until we're ready to give you a grant offer. And so that is for the design grant. So there's two different grants and different cost shares that we were talking about that drove that whole slide, and now it's impacting our timeline.
Well, how much is the carry it till we give it to you? How much is the carry it? Like in dollars? How much is design is?
That we only have an estimate on right now.
You know, it's hard to say without having the scope of work, but I mean, design in general is 5 to 10% of construction, so $2 to $4 million. Sorry, I can't narrow it down until we start negotiating. And as far as what the share would be, so if it's, okay, so it's 40 million total. It would be 36 million to do the 100-foot width. So you're going to pay 10% of 36 million, so that's 3.6 million. And then you could pay the additional 4 million for the widening, so you're at 7.6 million total, based on current estimates.
And then 2 to 4 up front.
You'd essentially have that on temp note.
We would, one of the questions I had was, from an engineering standpoint, is there any, you mentioned we're kind of over our average lifespan. Is there anything to date that you've seen in the runway that causes you that we're not going to make it to 2024?
No, I mean, your runway doesn't have significant structural issues right now. The surface is eroding, and so the runway is grooved for more friction and better drainage, and so those grooves are wearing away. So, potential little skidding and sliding on the runway, and then you're going to have more FOD issues. So the maintenance budget, the repair budget at the airport is going to increase over time, but getting another 5 more years out of it, I don't have any significant concerns at this point.
So from my standpoint, I think we're going to have a lot of fluctuation in funding from the feds. I mean, we've been going back to DC for multiple years now, saying we need national infrastructure. The comment that the same amount's been levied for a growing number of resources, that's not sustainable at the federal level. So Congress is going to have to do something to provide more revenue to everyone. And so I think something will give. We've been hearing of a need for infrastructure money for a long time. So the state's starting to get into some infrastructure funding. Salina just got a round of funding for a hangar that's more related to economic development. And I'm not saying there's a lot there, but I think we've got time to. I wouldn't recommend today that we go down a path where we're fronting the design. I think we should wait till we get a design grant. And I think we use the time in between there to try and solidify and advocate for broader funding.
So I don't know, tonight, I mean, when we look at this big picture, what are you looking for tonight? Are we looking at, design? I don't understand what the discussion is, because I really do want to talk about financing, and I do want to talk about design, and I want to talk about the plan and the closing of the airport. So is that the purpose of the work session, or are we looking at having
It's more of a brief.
just a briefing right now?
This is
Okay.
just an update. We haven't had an opportunity to come back to you to talk through the project. And as you can tell right now, it's a fluid process. We're still getting new information almost daily from the FAA. So it's not anything we're ready to present on or
Yeah.
make a recommendation for.
So really, the FAA required us to do a master plan update in order for them to even consider us for a design and construction grant.
Right.
Which then they told us, well, we need to dive a little bit into construction, but not too much. which, you know, I would argue it would have been great to have a full geotech. So we could have had that analysis, but they weren't willing to pay for it. So from this standpoint, this is the master plan update and what we need, what they've shared with us about recovering some of the 400 feet on takeoffs. And so what do we need to focus on in the future and creating these CIP items for the future. The master plan isn't necessarily saying you got to do this on this year.
Right. So sorry.
If I could add one thing, because I think this will help. We are not complete. We are 2/3 complete on the master plan side. The next phase is the financial. So what we are going to do from here is we're going to go back, we're going to take the recommendations from the SMS panel, we're going to prepare and formulate a 5-year ASIP, and then a extended 20-year ASIP. And what we will do with that is we have a sub-consultant that's a financial, an aviation financial analysis, and they're actually going to go and look at the revenues, expenditures, and the capital plan, and then try to match that to local funding resource availabilities and federal resource availability. So our next set of information will have much more specific information when it comes to funding eligibilities and things like that.
I mean, as far as the plans are always great, but what I've experienced in my tenure here is costs increase when we try to stick with the plan because of inflation and all of these things that looked great 2 or 3 years ago. We have to look at differently because we don't want to commit ourselves to a plan and somehow feel obligated because we said we were good with it. I think the 150 is something that I was not going to be flexible about anyway, because it seems like that's the right thing to do regardless of what the FFA was saying. Did I say FFA? FFA? Okay, good. And now Jared got me all messed up. The funding is key because there's so many, we're not talking about hundreds of thousands of dollars, we're talking millions of dollars. And when we're talking about millions of dollars, each year we wait, that increases even more, even if the plan is the same. That inflation and everything keeps increasing. So I want us to be cautious about that. One of the things I would like to see at a next session we have about the master plan is, you just talked about having $3-point-some-odd billion. It's been stagnant for so many years, but the regional airports have increased. So that pie is being shared by a heck of a lot more airports. And in Kansas itself, if you have Wichita, Salina, I don't know about Topeka, but Kansas City is doing huge, big stuff over there, and everybody wants their own airport. I wonder what that piece is going to look like for us. Even though they've consistently given the 90%, will they still be able to do that unless that funding source increases? And what I know about Congress is they're good with continuing resolutions, more so than actually budgeting for current situations. And the infrastructure that we've talked about, I mean, the build grant is something we've been struggling with. So that's, again, an ongoing discussion. So my concern is how much can the federal department, federal aviation, dedicate to this. I do think this is a priority because I do think we're doing well. You pointed out some of the data and the numbers. The price tag is something, even if we have to put up $8 million, anywhere from $5 to $8 million during that timeline, we have to gauge that very cautiously. I always think about last week when we had the conference center and we thought 3.5 and it was $1.5 million more. So I just, but what I want to see, like I said, at the next sessions, whenever we discuss this, I would like a list of what they have funded for the Manhattan Regional Airport over a period of 10 years. When we say they've consistently given us 90%, what does that mean? And when have they not done it? I want to know when they have given it and when they have not, when that has not happened as well. And the regional dedication of funds they're giving to some of our other regional airports. What is our competition in this area? And what is the likelihood we will see some of that money coming to our airport? I don't understand everything that I see as far as like a demolition taxi. It sounds simple enough, but I know it's a lot more than what's there. And costs, like I said, are always impacting our decisions, but the airport has been something very good for Kansas State University and for our businesses, and that is one of the reasons we're thriving. So this is an investment where I want to see us put funds into, but again, we need more information. I'm not opposed to the plan that's been designed. or the plans that we're discussing now, funding is going to be the key part of it. And I think these suggestions you've made seem something that we should be doing. I am concerned about, I don't want something that happened with the Country Stampede to happen to some of those airports that are using it now, and then we shut down for 60 to 90 days, and they find some other place that's better, and they stay there. You know, we want them to come back, so we need to figure out a plan to bring them back once they go. So I want us to think about those things.
So the master plan, that's funded, right? Yes. Okay, so we're there. But next summer, we'll be talking about what the 2021 budget, and so on your timeline there, what I'm interested in, it says design, what's the impact on that budget? Okay, because the sales tax didn't pass, and we told everyone that, you know, the sales tax is gonna fund this, so I'm gonna assume that'll be a property tax impact. It's gonna have to come from somewhere. So, you know, what's gonna be the impact on the 2021 budget, 2022 budget? And I know that, you know, you can't tell me that tonight, but that's really where we're going on this, because, you know, a lot of people have looked at, you know, that sales tax failing, and they're saying, oh, the message to the commission was, don't do any of this. And I'm not seeing anybody suggesting closing the airport. You know, so that's the dilemma I've got. I want to know where that is, and then people are saying, well, no sweat. If you've got to build the airport, just fund it out of existing funds. So, you know, if we're going to do that, fine, then we got to figure out what we're going to cut. You know, and that's really where we're at, because, you know, the voters think they sent a certain message. I'm a little bit confused on the message that was sent myself, but I need some hard numbers on that. And 2021, that's next summer for the folks that are going to be here. And so we need to start with that. And I know you've got, you know, this wild card with the FAAA. So, you know, if we could somehow quantify those CIP things, that would really help. And then the other point that, you know, if I heard right, you said that Salina was under the same constraint of a, you know, 100-foot runway, and Topeka also, Forbes Field. That makes little sense to me, having spent a lot of time at Fort Riley in deployments, because as I recall, the plans were a lot of times fly out of Forbes, fly out of Salina. How can the FAA close everybody down to 100 feet? This makes no sense with the military, you know, and then maybe we could capitalize on that and say, hey, if you're gonna close all them, we need 150. You know, so we can fly guys out of Fort Riley, because that just doesn't compute to me at all, that the bureaucracy would just leave a hole on that for the military aircraft.
Just a quick point of clarification on that. Topeka was reduced from 200 to 150. So not.
So they would still be able to use that, so
Yeah.
that wouldn't be a valid argument for us then.
And I will
because
tell
they
you
could-
too, there's an underpinning of federal agency after federal agency. The FAA does this because they want the DoD to throw in some skin into the game too, so.
Okay, well, maybe we can still leverage that as a thing with the post being here, and I know they fly, you know, aircraft in and out of there, and it would make sense, you know, to get them on board, and maybe that'll help free up some funds.
To kind of add on to Commissioner Reddy and Commissioner Butler's comments, I won't really speak specifics to this plan because I won't be on the commission that ultimately decides the direction that we go. I think my kind of general point that I want to reiterate and make till I get off the commission as we talk about these projects is ultimately the number one goal of our budget going into 2021 and 2022 should be figure out how can we stop being forced to raise the mill levy just to cover employee costs. And until we can figure that out, none of the rest of this to me is as important as that. And I think the response and what I hear back is, well, Jared, we have to stimulate growth in order to get that budget even. And if our government model and our taxation model relies on constant and new growth, that is unsustainable over the aggregate. In the private world, we'd call that a Ponzi scheme. So that's number one, is we have to figure out how to sustain our budget to just year to year. If we don't grow, we're not forced to raise the mill. And so I think that presents really big challenges and issues for all of these projects going forward, because I mean, if you look at our budget and you could cut almost everything that's a one-time expense for us in terms of, you know, all of the funding that a lot of it we've shifted to the ED fund, and maybe it garners you $1 million a year, but it's still not much. And so I guess my general message is should do everything that we can to make sure the FAA is funding at 90%, but we also need to be advocating on the state level for revenue sharing again, or changes into the income tax model, because what we're doing right now is not sustainable. And project number one for the commissioners going in 2021 budget should be, how can we make sure that step increases and employee benefits aren't forcing us to raise the mill every year, and then all of this comes after that. So that's just my general take on it. This is a worthwhile project, and it's something that we could do. I'm just scared that the constraints we'll find ourselves over the next 2 years will make it quite challenging.
I would just say that I certainly support getting 90% from the FAA, and I am eager to see our runway length at 7,400 and our width at 150 feet. I think that in order for Manhattan and our airport to remain viable, I don't want to have the communities on either side of us be the 150 feet and we get stuck with the 100 feet, which means we're just a regional. And we also have big planes that come in here occasionally. And so I want to be able to support that. And I think we heard from K-State, and we may not hear from Fort Riley here, but I'm sure that they have an interest in this too, and I want to be sure that we work that area with our U.S. senators and congressional delegation. We can't do this by ourselves, and we are just as some of the other projects we have to work together with these partners to be able to afford anything, because there's no one source of money coming to us. We've all been waiting for infrastructure money, and that's been a little slow, if non-existent. And I have heard that the federal government is upping the amount of match they're requiring on everything. So we haven't, I don't want to delay this so long that we lose out on some of that funding from the FAA.
Just a couple of things on probably about slide 4, where this challenge with the FAA, where they said we can't design until we plan, and then we can't finish planning until we know what to design. Is that essentially sorted out? I just want to make sure we're not going in a circle here.
It was kind of an iterative process at this point. A little bit of planning, a little design, a little planning, a little design.
I would say we're 90% figured out, and I would say that it's not necessarily locked in this problem. It's just simply we have a very complex, and I think Diana described it very well today. We have a Rubik's Cube situation where we have issues interrelated, so much so that you turn one, you turn the other. And so we're working through that. I would not put that on the shoulders of the FAA, other than the recent roadblock of funding eligibility that became the issue, which has complicated some of our going forward thoughts. That's all.
I just want to make sure there's a clear path forward to get to the 30% design that then yields what we think we're going to get on construction.
Well, the 30% design is going to wait now till it won't. I don't believe we're going to do a 30% design. We're going to wait and do the full design in 2021. So we're doing kind of a capital improvement plan level design now. I don't know how you describe it, 10%, less than 30%, 15%.
So the other proposition was that we won't find out how much grant we get until we get to 30% design is not where we are, or is where we are?
Kind of not where we are. And so, when I wrote these slides, I was giving you the best information I had at that moment in time. And it probably conveyed to my level of frustration that I've had with the FAA. Again, before I had a clarifying conversation with the manager, it was after getting a letter that completely contradicted what his staff had been telling us. And so we had just found out that they were rolling us over for another year for design. And so each year we were supposed to get $1 million in entitlement. By the time we get to 2021, we should have $3 million banked up. They want to have us, they want to be in a position where they don't have to rely upon discretionary funds, which are very competitive. And so it makes sense from their standpoint. They haven't been very forthright about it. At least our planner has not. The conversation with the manager was more forthright, and his assurance was they're going to look to do the 90%. He did not add the additional language of, you have to wait though until you're 30% in design to figure out how much we're going to share with you in construction. And so those were kind of the games that the state planner was playing with us. That again, it's my frustration that conveyed on these slides.
Okay.
But I think we've moved past that a little bit from the conversation we've had with the airports division manager, and we're going to bank on the last word that they've given us thus far.
On the multiple stage approach, I think you said there's 230s where you've got, you don't have a 5,500 foot availability, and then there's a 40. Was that just not full capability because it's closing the crosswind, or what was that one? Because that adds up to.
If we do the 4 stages of construction, the main runway is closed for 53 days, and we have reduced length for 40 days.
Okay, so it's still meets
Well,
the
it's 55, the main runway will be closed 55 days, reduced length for 40 days, so the whole project takes 95 days.
But the reduced runway length is still 55, which is
5,500,
adequate
it would be
for
the short,
operations, right?
the shortest we would go is 5,500.
Yeah, all right.
So that there could be some operational capability.
So, yeah, I think
Are we still?
a couple of things there. I think we've got to have the 150, and I think unless something else happens, the multiple phase approach makes sense. And here's my thinking on that. If you completely shut the runway for a long period of time, I think what Usha said probably holds, and that is, once people find another comfort level of transportation, it's tough to pull them back. So what that means is, what do we do even during these 30-day periods? I mean, are there alternatives like going to Salina and using buses or something? I don't know what it is, but we probably ought to have that as a plan B or plan C, just so we don't completely stop services of any kind. And I think keeping the GA open is important too, just so we have some revenue and some operations going out there. And then finally, I mean, this is going to be quite a task, but I think we've got to have, as best we can, kind of this, what you've talked about, Diane, which is, okay, well, let's plan to have the design finished here. Here's when we think we can do construction based upon when the money might flow, just so we kind of have this timeline in the next couple of months a little bit more clarified. And then, Ron, we're gonna have to find kind of what this means in terms of temp notes or other funding capabilities that might be out there, whether, you know, some of our senators come through with some kind of a help for us, or whether there's other funding available. Even DOD, you know, would
Sure.
would be helpful, so.
I think there's several options that we could make and take and try to pursue, but just to answer Commissioner Butler's question about the 2021 budget, I mean, all of our major projects that we plan for, we do temp notes on design as well as construction. So the full budget impact typically isn't till 4 years after we start that process. So there really wouldn't be any budget impact, assuming we got a grant offer in 21, because we would issue temp notes for that type of project. So specifically there wouldn't, but you know, I agree with the mayor that you know, using that time in the interim to look at various scenarios and transitioning and all of that will be critical.
Okay, and now for the bad news, huh? Okay, well, Mike and Diana and Jesse, we really appreciate it. I think you've done a great job answering questions that are not yet decided, so, and, Linda and Rich, everybody, we appreciate coming up and contributing to this. So, We welcome you back in a couple of months to see where we are.
Okay, thank you.
So thank you. With that, we are adjourned.